All right, ladies and gentlemen, BioPA here with 911 BioCare, and the guys have asked me to do a video on the myths of testosterone replacement and prostate cancer. So what I'm going to do is I'm going to try to kind of lay out the facts for you as best we understand them, and hopefully give you enough information to empower you to make your own decisions. Okay, so first thing, let's begin. Let's talk about low testosterone levels in men. When does it happen? Why does it happen? And what are the consequences potentially? So starting at the age 25, your normal testosterone levels begin to decrease. And the reality is we're seeing a lot of patients come in that are as young as 30 and sometimes even younger. And their testosterone levels are already down in the 300s. Now, mind you, we would consider, a normal optimized testosterone level to roughly, be somewhere around 600 to 1,000. That would be kind of a healthy level for a 25-year-old. And we're seeing levels in the 300s time and time and time again. And these aren't people that are couch potatoes or that are ill. These are active people that have active jobs. They exercise, they eat right. They have all, at least two of the components of the triangle all there, and yet their levels are still terrible. So what are some of the things, what are some of the symptoms of what we call andropause? Fatigue, low libido, decrease in physical fitness, meaning you're doing the same workouts, but you're not getting the same results you used to. Loss of muscle mass, loss of bone density, lack of competitive drive, and even erectile dysfunction. Also, in addition to that, when we look at the things that can happen as a result of andropause, you're looking at diseases, increase in diseases like diabetes, cancer, heart disease, stroke, memory loss, Alzheimer's, and just inflammation in general. Okay, so that's a little bit about testosterone itself. Let's look into the myth, because the myth was that if you gave testosterone replacement to someone that had prostate cancer, it was like pouring gasoline on a fire. And that's what we were all taught. That's what I was taught 14 years ago. That's what everybody's been taught for the past 40 or 50 years. And let's go back now, because we have real data, and let's look at where the origin of that myth came from and what we've learned since then. Okay, so the origin of that myth, and I always like to get my facts right. So the origin of that myth came from Dr. Huggins back in 1941. Now, Dr. Huggins was well respected, still is. He went to win a Nobel Peace Prize, not for his research with prostate cancer and testosterone or anything, but he was a Nobel Prize winner at one point in his life. However, in 1941, he did a study with 3 patients, all of 3 patients. That's it. And back then, they used to use a blood test called acid phosphatase. It was what they considered a marker, and that's been phased out. That test is not even really considered a good marker for prostate at all anymore. And so he used that test, and he had a few patients, one in particular, that had prostate cancer, and he had been castrated. So that's what they used to do back in the day. They would physically castrate you in order to try to cure, quote unquote, your prostate cancer. So this patient had a level of 0, and or close to 0, and they gave him some testosterone replacement, and then they checked this blood level of this acid phosphatase, and it went up. So Dr. Huggins surmised that the testosterone would lead to or hurt prostate cancer. Well, it wasn't a very good study, and even Dr. Huggins, I think, later admitted that that's not a very good sample size. What we have at A4M Dr. Morgentaler has done some extensive research because he started doing testosterone replacement, 20 years ago when it was really not even fashionable. And he was very conservative and very, very careful. And so what he did is he decided that he was going to do a prostate biopsy of every single patient before he put them on testosterone replacement therapy. And what he found was he found a significant number of positive biopsies in men who had otherwise had normal PSAs and normal digital rectal exams. So that was kind of the first interesting fact. Through his studies and looking at the other information, other studies that were out there at the time, basically what he came up with was this. And what he kind of calls it the kind of watering a plant theory. So the reality behind it looks a little bit more like this. If you have prostate cancer and you're willing to castrate yourself physically or chemically and basically drive your testosterone levels down to zero, it could aid possibly in making the prostate shrink and the cancer kind of shrink a little bit as well. However, if you have any testosterone in your system, then it really doesn't matter how much. And to be more exact, what the threshold we think is at about 100. So if you have 100, if you do a blood test and you have 100 on the blood test of free testosterone or above, and that's of your natural testosterone, it doesn't matter if you have 100 or 1,000. It doesn't make any difference. It's not feeding the prostate cancer. And we found this study after study after study. In fact, if you want to expand on that, we'll expand on that in a second. So let's go back. So if your levels are less than 100, okay, you might calm things down a little bit if you're willing to go that route. But understand, testosterone plays an important role in a lot of things, hundreds of different things throughout the body. It's not just masculinization, it's not just building muscle, it's not just getting erections. It's a lot of stuff. It's depression, it's a potent brain hormone, it is a potent anti-inflammatory. So if you were to cut your levels down to zero, it would increase your likelihood of dying from probably 5 or 6 other things, but you would get a little bit more protection for the prostate cancer. And also keep in mind that, a lot of men have prostate cancer. Very few men die from prostate cancer. So we got the threshold theory. Anything 100 or above, it doesn't matter. It doesn't matter if it's 100 or 1,000. It's not going to contribute to the cancer anymore. So Dr. Morgentaler actually took it a step further many years later, and he actually did some tests where they took men that had prostate cancer, but prostate cancer that was of the kind of diagnosis that it was okay just to monitor it. It didn't need surgery, it didn't need treatment, it was okay just to watch it. And he took a number of different volunteers, quite a few, I forgot the exact number, and they put them on, testosterone replacement theory, a plan, testosterone replacement, my memory's going to, testosterone replacement program, a conservative one. We're not talking about, going crazy and doing superhuman levels. That's bad. And we're talking about bioidentical. To restore their testosterone to, normal levels. And when they went back and checked these men like a year later, not only did none of their prostate cancer progress any further, there was a large portion of the patients and once again, I don't want to quote numbers unless I know them exactly, but there was a large number of these patients, so probably greater than 10%, where their biopsies came back negative, completely negative. So that's the kind of prevailing wisdom. So, basically, most of the research that we have out here now says that no, there is not a connection. It's not like pouring gasoline on a fire. Absolutely not. I don't believe that. I don't know too many people that do believe that anymore. There's tons of papers out there and scientific studies to show that that's not true, and to show the opposite, that this is a potent anti-inflammatory, among other things, and inflammation plays a key role in vessel disease, so stroke, heart attack, things like that, not to mention all the other things that we already talked about. So there was also another study. I think we'll do a separate video on the recent poor study that was done trying to implicate testosterone with a heart attack that was done at the end of 2013. It was, let me just touch on it and tell you, it was a terrible study. It was just poorly done. Their own numbers didn't even add up, and so we'll probably do a separate video to address that. So if you want to learn more about this, go to A4M's website. That's the American Academy of Anti-Aging. And then the other thing I'm going to suggest for you, and hopefully we can get this to show up, is this book. Okay, this is called Look Good, Feel Younger. It's by Dr. Edwin Lee out of Florida, and it's a great book. This is a book that really goes in detail about all of the hormones, not just testosterone. It talks about estrogen, it talks about progesterone, it talks about nutrition, adrenal fatigue, all those things. And it goes into depth about them, and it also goes into depth about the risks versus benefits, and it provides you a list or bibliography of all of the studies, the scientific studies that were done to support all the claims that he's making, and basically all the claims that we're all making right now. So pick this up if you want to learn more about that. I'll try to put a link down here to make it easier for you. But this is a great book if you're interested in hormone optimization any way, shape, or form. You want to know why you're feeling the way you're feeling. Look it up. This is a great resource. I think for you, it's even a great resource to take to your doctor's office if you're trying to explain to them why you want to do this, or if you're already on it, why you are doing it. So anyway, take care, be well, and we'll see you soon.